Local programming on KRWG Public Media made possible in part by viewers like you. Thank you.
Welcome to a special hour-long program of Issues and Answers. I'm Johnny Coker. In this episode, we're going to look at the COVID-19 recovery, what legislators are doing to address COVID moving forward, and how local communities have changed over the course of the pandemic in order to minimize the harm done over the course of the public health emergency. But first, let's take a look at how some Las Cruces middle schoolers are taking action to improve the air quality of their school. At Mesilla Valley Leadership Academy in Las Cruces, middle schoolers are taking action and protecting themselves against COVID-19 and other pollutants. The class began building homemade air filters, known as Corsi Rosenthal boxes, after Lily Hauseman, a 6th grader, put forth the idea after building the filters with her father, who was hit hard by COVID-19 in August of 2021.
And I decided that was a good idea for not only his protection, but also everyone else's, because it helps stop the spread of viruses. And the principal agreed, so then he talked to my science teacher and she was really interested.
Lily said that she's happy to be engaging in a project that helps keep the people around her safer.
Yeah, I do think they should be used more. Like, they're kind of underrated. Like, they're not exactly the prettiest, but that's not really what counts. It's what they do for us.
Lily said that it's important to make sure that the box fan is oriented correctly in order to avoid having to spend more time rebuilding. She added that for those who may not like noise created by the filters, a taller box makes filtration quieter. Heath Hauseman is Lily's father. When he got COVID-19 in August of 2021, he went from regularly working out to having health problems and still experiences what is known as long-haul symptoms.
It was like 15 months that I was essentially disabled. And unable to do very much. And I started improving just in September, and my brain is working again, my body's working again. I still have to manage it really carefully, but I'm doing a lot better finally than I had been.
After becoming ill, Heath began researching air filters and through social media discovered the Corsi Rosenthal filter, a relatively inexpensive homemade box filter to help reduce virus transmission and improve air quality in his house.
I really think in addition to being a health and safety issue, it's a really great educational exercise. And I know with our kids during the pandemic, it was a place to put their anxiety about COVID, that we're doing something tangible that we can understand that makes a difference, and I didn't feel as anxious.
9 students at the Mesilla Valley Leadership Academy built a total of 9 box fan filters in an effort to reduce the spread of COVID-19 and to help protect family members who may be vulnerable to the virus. Lily's science teacher, Tracy Meixel, said that building the air filters gave students a sense of control.
Because it seemed like such a big problem, but this was a small piece of the problem we could work on together to solve and to make it as safe as we could for the students. And so they knew that, and they knew that we were doing the best we could to take care of them. And then with the filters, they had that extra insurance maybe. And so extra, calmness of mind, peace of mind that, school was a safe place.
Meixel said that teachers were buying commercial air filters, but price was a significant setback for many, especially with high demand during the peak of the pandemic, with many commercial HEPA filters costing hundreds of dollars.
Here we want the kids to take as much control of their education as they can. And so when we can put them in a leadership role, we do. So she taught the other students how to make the box fans, and then they all worked together to make the box fans for all the classrooms and the cafeteria.
Mesilla Valley Leadership Academy does not have a way to test the effectiveness of the Corsi Rosenthal boxes. However, there is research that shows that the filters do enhance indoor air quality. Megan Jean, a professor and researcher at Arizona State University, has been working on projects surrounding the Corsi Rosenthal boxes. She said that the homemade filters are highly effective, according to research data.
They've been evaluated by the CDC, by other academic researchers. They work just as well, if not better, as many commercial units for a fraction of the cost. and they can help push clean air into classrooms. We know that they can remove or reduce by about 70% your exposure to many common viruses and allergens.
Jean said that she feels it's important for individuals to monitor the quality of their air and treat it the same way they would their water.
Indoor air quality is invisible, and so I think what we're trying to do is sort of make that invisible concept more visible to others. And so think about what we can do to improve our health and the health of those around us.
Jean said that building a Corsi Rosenthal box costs around $80 to $100 and is a great way to take matters into your own hands when it comes to indoor air quality. However, the filters don't last forever and must be replaced every 6 to 9 months in order to maintain effectiveness. Today we get to hear from Professor Megan Jean, who's doing research at Arizona State University on Corsi Rosenthal boxes and how air filtration systems can help raise our quality of life. Dr. Jean, thanks so much for joining me today.
Thank you for having me.
So let's go right into it. Tell me about ASU's Clean Indoor Air Project.
Sure, I'd be happy to. Well, I'm an infectious disease epidemiologist at ASU, and I have worked throughout the pandemic trying to slow the spread of COVID in schools. And the more we looked into this, the more we realized that we were seeing a lot of transmission, a lot of school outbreaks, and we really wanted to think about what we could do to help. And improving air quality is it's our least used but most effective intervention of this entire pandemic. And we know that many schools are under-resourced. We know that they have aging infrastructure and poor air quality. And so we have been offering these DIY Corsi Rosenthal boxes as one way for schools to make an impact on the air quality in their classrooms. And so we're providing these boxes to schools. We're working with schools to integrate them into their curriculum, to have the kids build them in class, and to really take ownership of this hands-on public health intervention that they can do to make an immediate impact on their health and their teachers' health and their community's health.
Absolutely. So for our viewers and listeners at home, what exactly are Corsi Rosenthal box filters, and what do they aim to do?
Great question. So they are a DIY air filter. So it works just like a HEPA filter. And they can trap viruses, molds, allergens, all kinds of particulate matter that's in the air. So basically it's 4 air filters. You tape them together in the shape of a box, and you put a fan on top. These are materials that you can find at any local hardware store. They've been evaluated by the CDC, by other academic researchers. They work just as well, if not better, as many commercial units for a fraction of the cost. And they can help push clean air into a classroom. So the dirty air comes in the side, it's trapped in the filters, and the clean, hopefully virus-free, allergen-free air is pushed out the top.
You say they're as effective as these commercial filters. How do you determine that? How effective really are they? What do the data say?
So they put them through these kind of fancy laboratory tests in laboratories at the government and academic institutions, and they can measure how many particulates they remove from the air. So we know that they can remove or reduce by about 70% your exposure to many common viruses and allergens.
So how involved are you with these sorts of studies, and can you walk us through that research process?
So what my research team is trying to do is we have a couple of questions. So we're interested in the sustainability of this intervention. So how well does it work in a real world classroom? So getting it out of the lab in places where students can build it, teachers can build it, and how well does it work in a real world classroom? How long does it last? So what's the impact on the environment? How often do we have to change the filters? How well tolerated are these interventions by teachers and students? There is a bit of noise. We look at the air quality. So we're putting some sensors in the classrooms and taking air quality measurements before and after we place the boxes.
A lot of people throughout the pandemic became frustrated because they felt like they couldn't do anything about it. But now that we have these air filters that virtually anyone can build, do you feel like there's a mentally uplifting aspect to people building these box fan air filters?
100%. I think for kids especially, when I'm out in those classrooms and they are doing something after feeling so helpless for so long, they are just really excited. This is something that they can do. They are making a difference, and it's just real excitement. And especially when you can show them the impact of their work, show them their air quality graphs and say, see this graph, look how it's going down, look what you did. They are just overwhelmed. And so we love doing it.
So I know with the Clean Air Project, how many schools have you been to have been affected by these filters?
Our team has built about 450 individual filters. We've placed them at hundreds of schools all around the valley, from the northern parts to the southern parts along the border. And then we've worked more closely with about 4 or 5 schools who've really adopted this intervention, decided to place the boxes in every classroom, top to bottom at the school. And so that's kind of this phase 2 of our project, is trying to figure out, what happens when we do this school-wide intervention, and can we see an impact hopefully on health? That's ultimately where we want to get to. Can we see a reduction in viruses or illnesses and absences? And can kids should be able to focus better when their air quality is better. There's lots of science showing that it impacts your ability to think clearly, to focus, to do well on tests.
Can you go a little bit more into about how clean air affects these children, and how it's not only helping with viruses, but it's helping with other sort of pollutants like CO2 emissions and things like that?
Yeah, beyond COVID, there are numerous health impacts. We've known this research for decades, so this is not new. It helps with asthma exacerbations, so less frequent use of medications and trips to the nurses, helps with allergies. There is data showing an increase in test-taking ability, being able to solve, puzzles because you can focus clearly when the air quality is better in a classroom, and then transmission of other respiratory viruses, RSV, flu, all the other seasonal respiratory viruses that are spread through the air. And we know that as the air quality increases, the amount of other people's air that we are breathing in also decreases. So if you think about, we exhale CO2, and when that builds up in a space, then the likelihood that we are breathing in other exhalations from other people around us increases. And that's the last thing that we want during a respiratory pandemic.
For somebody who may not pay attention to this issue, what would your appeal to them be? How does this matter on a societal level?
This is a broad health issue that anyone can get behind. Lots of us have health issues. We have interest in protecting everyone around us. Indoor air quality is invisible, and so I think what we're trying to do is sort of make that invisible concept more visible to others. And so think about what we can do to improve our health and the health of those around us.
Absolutely. And the COVID-19 pandemic, as you touched on, did bring a lot of attention to indoor air quality. What would your appeal be to local governments be? I mean, is this something that you think needs to be regulated?
Well, I hope so. We don't regulate air quality the way that we do water. And for many of us, it would be unthinkable to have dirty water coming out of a tap. So I hope that we can provide more health-based guidance for indoor air quality. Right now in schools and many public places, people are doing the best that they can, making value judgments about how good should that ventilation be. But we don't have really a lot of tools and resources for schools, for business owners to figure out, step one, what is my air quality and what can I do to improve it? So yes, I absolutely hope that we start seeing a lot more of this guidance, both locally and across the state and across the country.
So throughout this process, through the pandemic and through building these air filters, what has been the biggest thing you've learned? What has your biggest takeaway been?
For me, I think it's that we're not helpless. And so even though we have had this pandemic that has really rocked us to the core, there are little things that we can do, as individuals, as scientists, as a community, to really make a difference.
In terms of the air filters, the homemade built ones, do you see any limitations in terms of them, like in terms of noise or perhaps mobility or maintenance, anything like that?
It's a DIY solution, so it's not a permanent fix. And so this is something that schools can do is in the interim while they're waiting for large, updates to their HVAC systems. But yes, there is some noise. It's about equivalent to a refrigerator running. So for some, the background noise bothers them. For others, it's kind of like a white noise, and we don't see the impact. They are large and bulky, and so, there are some limitations, but I see what's really interesting to me is you see people out there in the community innovating on this design and improving it, making it like a smaller profile, improving the look, the function. And so it's kind of just this exciting social movement for me.
Definitely, that is exciting. So for our viewers at home who may be interested in building one of these filters, do you have any advice for them, any tips or tricks per se?
Well, the quality of the build is important, and we have some resources on our website. Many of our students have built how-to videos with some tips and tricks for using the right supplies. But I would make sure use the best quality air filter that you can find. So MERV 13 rating if you can find it. A thicker filter, like a 2-inch filter, better than a 1-inch filter. Good quality duct tape, and then just make sure all the seals, all the air gaps are sealed along the sides. It's what we tell our students, to always look for any gaps.
Sure. Well, thanks so much for your time today, Professor Jean. Is there anything else that you'd like to plug, websites or anything like that?
We have an ASU Clean Indoor Air Team website, and I can drop the link to that, or people can Google us and find it. It's Arizona State University Clean Indoor Air Project, and we have lots of articles and resources up there to help people get started. And we have a brand new library project in Arizona. You can check out some air quality sensors at public libraries and kind of be a citizen science, take it out and explore it. So we're hoping that movement will spread to public libraries in New Mexico and other bordering states soon.
Absolutely. Well, thanks so much for joining us today. I really do appreciate it, Professor Jean. You can learn more about Corsi Rosenthal box filters at krwg.org or southnmnews.org. Moving on, we're talking to New Mexico Representative Christine Chandler. Representative Chandler, thanks so much for joining us today.
Well, it's great to be here with you, Johnny. Happy to discuss.
Absolutely. So can you just give me, I know you introduced House Bill 30 in this last legislative session, which talked about, getting clean air into schools. Can you just tell me more about that and the reasoning behind you sponsoring that bill?
Sure. I think we've known for a long time that air quality impacts, student success and student health. But COVID-19 and the pandemic that we've just gotten through really highlighted the need to ensure that air quality in the schools and frankly other places is at a good quality and that there's good ventilation. So we brought this bill in the last session, and actually we've brought it in prior sessions, other sponsors have, as a way to ensure that we are addressing an issue that is not only something that occurred during the pandemic, but something that will impact us moving forward. So we know that asthma is affected by poor air quality. There are other allergens in the air that need to be addressed in the schools, and that students are impacted by poor air quality, influenza, COVID, students, teachers, all personnel in the schools are impacted by poor air quality, and it needs to be addressed across the state.
Absolutely. And so even though COVID has elevated the issue of air ventilation. It seems like, efforts to get legislation passed related hasn't really gained much traction. So what do you attribute that to?
Well, I think I would disagree that it hasn't gained traction. The bill did not pass because there was concern about funding and the issues of how we'd go about implementing it across the various school districts, all of who have different needs and different ventilation systems. But we did pass House Memorial 7, which directs a study this summer by the Public Schools Capital Outlay Task Force to come up with a proposal for implementation of improving the school ventilation system. And it will identify needs, and it will also identify funding sources. So, government doesn't always move as swiftly as we would like. We know that. But there's often the next step that happens. And in this case, the next step is going to be, a detailed study and a report is due in January before the session starts, so that we have an opportunity to bring legislation forward that will help us implement a program across the state. But it's always funding. Funding is always an issue when we're dealing on an issue of this magnitude, and also how, because every district has their own needs and different kind of pre-existing conditions.
Right. And to sort of stay on the subject of funding, I mean, looking at the fiscal impact report of House Bill 30, cost for ventilation assessments across New Mexico schools would, cost tens of millions of dollars, and replacing like certain systems could even be in the billions. So what's your take on that, and how do you envision, these types of policies being attainable with that kind of cost?
Well, certainly millions of dollars were identified as part of the need, and I think that the number was $1 billion in terms of what the fiscal impact report, just to set the stage. In our current budget, $65 million is available to fund these kinds of projects. And in addition, schools have in reserves, many school districts still have in their reserves federal monies up, and I think they total close to $1 billion across the state that could be used to help upgrade ventilation systems. So the situation is not as dire as you might, as people may view it. There definitely is money available, and it may have to be incremental, meaning we'll have to take on a certain number of schools one year, another number of schools the following year. I think it's unreasonable to expect that we're going to get all of this done in one fell swoop. It's going to be a progressive approach over the next few years in terms of upgrading ventilation systems in the state.
Sure. So, what would you say, because I think a lot of people in New Mexico might say that schools haven't hard enough trouble getting funding already, especially in rural places and around southern New Mexico. So what would your argument to those people be that say, ventilation should take a backseat to some of the other, funding needs?
Well, I mean, when you're talking about funding any kind of a program, there are competing interests. But we know that studies show that if in terms of student success and health and wellness, ventilation is more important than I think is obvious to people. I think part of the problem is it's not evident and it's not prominent in people's minds when they're thinking about what is involved in student success, and what COVID did and the pandemic did, and what the various kind of crises we went through in these last few years has highlighted is it really is a critical part of the learning process to ensure that there's a good environment and that there's a healthy environment for both teachers and students. And I think people are starting to get it. And let me just share a story with you. A constituent reached out to me during the session because he saw that I was sponsoring ventilation legislation, and he asked me about the ventilation systems in the Los Alamos public schools. Why? Because his son wanted to move into a school district where they felt comfortable sending their children, where the environment was a healthy environment, and they viewed actually the ventilation system as something that was important enough to make an inquiry about in terms of whether or not they wanted to choose the Los Alamos School District as opposed to some other. So I think people are becoming better informed about the importance, and that will bear on whether or not school boards and PED and others are willing to support what I think is a really critically important part of the educational process.
Absolutely. So, even though HB 30 didn't pass, what are some other policies that we could sort of look at and as an official, like even on the state level or federal level, what should officials look at in order to help keep the public safe from COVID-19 even as the federal public health emergency has expired?
Yes, well, I think I want to point out that we did a lot during the session to support healthy workplaces. And one important measure that we did enact is the sick leave policy requiring all employers to provide sick leave to employees. That took effect last summer. And what I think helped that bill gain momentum, and I was one of the lead sponsors on the bill, is the fact that people became more aware as to how important it is for people, not employees, members of the public, students, not go to wherever there are other people when they're not feeling well, when they may be transmitting an illness. So that was one thing we did. We required all employers, and this is particularly critical in the restaurant and service industries where there's a lot of contact between people that you don't know. And so that was one thing we did. Another thing moving forward I think we need to do is enact paid family and medical leave. We have brought legislation in the past on this, but this will support individuals with, for example, long COVID, which is a very difficult issue to address. And I know that members of the public who have it and residents who have long COVID feel a little abandoned, frankly, by the system because we don't understand it well. But if we offered paid family and medical leave to individuals with, chronic illnesses, serious chronic illnesses, that would also support them moving forward. So COVID was a watershed moment, I think, in history, and I think that's how we're going to look back on it. And it is going to drive, I think, social policies and other policies in a way that we're more cognizant of the fact that we need to support families and workers in a way that we hadn't before, and recognize that when they need time off, it's available, and we're not forcing them to choose between making a living, basic living, and staying home and keeping themselves safe, their family safe, and members of the public. So I think that's what we need to be doing. I also think we need to continue our efforts to expand internet service, broadband service across the state, because that too will allow options for people to stay at home when they need to, or even students to be able to participate remotely when they're not feeling well. And we are doing that in the state. Working with the governor, we created something called the Connect New Mexico Act, which is intended to fund expansion, and expansion is occurring. And we've passed legislation that makes the development of infrastructure easier. So those are items that we've been working on, and I think there's a good opportunity for us to support the public by enacting those bills.
Absolutely. So in my reporting, I've talked, you mentioned long COVID. I've talked with individuals who have been damaged by COVID-19 and do feel like they've been let down and left behind since the end of the federal government declared COVID no longer an emergency. So what is your message to those individuals? How can they be supported moving forward?
Well, I did note, certainly providing them access to leave. We have also worked very hard. The House legislative Democrats and others have worked very hard to expand access to health care. We've funded Medicare. We've added funding to Medicaid, so people with low income. And remember, we have many residents in the state who are on Medicaid. We have increased funding for Medicaid and made it more accessible for residents. We've made access to healthcare in general more accessible to residents. So we're very aware. But I think what we also have to do, and I think most of us do, is acknowledge that long COVID is a real illness, and it's something that we need to learn more about, but support those individuals. I think they feel isolated because people want to put that behind, people want to put COVID behind us. So as a result, we haven't, I think, given enough support for those who are suffering from the long-term effects. So definitely we need to ensure that those individuals have access to health care, that private insurance companies cannot use long COVID as a basis for a denial, that they have to include it as part of their health care coverage. And that is something to make sure that is available to individuals with private insurance. So Medicaid needs to cover it, private insurance needs to cover it, and we need to support efforts to understand it better, certainly. And of course, paid family and medical leave is something I've already mentioned.
Definitely. So, in staying on track with healthcare, declining mental health has also been a big topic over the course of the pandemic. So what are some solutions that you feel could be implemented on a governmental level to help people with those problems?
Yes, I mean, that's a very good point that you're raising. In addition to, increasing coverage for what we'd consider physical illnesses, we have enacted policies that improve access to mental and behavioral health care. And we have increased funding for rural providers and rural clinics just in this past legislative session. So that will also provide access to behavioral health care as well. And we have provided that mental and behavioral health care is treated the same as physical illnesses. So there has been a lot done in these last 4 years, and certainly there's more that could be done, but we have done a lot in terms of increased funding and support for both what one would call physical illnesses as well as behavioral health and mental illness treatment in the state. And I expect that we will continue to do so. But funding has been tremendously.
Certainly. So we're almost out of time, but I wanted you just to briefly sum up our session together. Do you feel like if there was another pandemic or public health emergency that we're prepared for such an event? Did we learn our lesson from COVID-19?
I think we're better prepared. Certainly there's always room for improvement, but we are moving forward to have better access to broadband and other internet services so that individuals who need to rely on those those services have access. That was very difficult on students, the inability to participate virtually and in terms of school. And so that, I think, will be in a much better position. And in addition, we will be in a place where we understand that people who need to stay at home will be able to stay at home given the various policy that we have enacted in these last few years. So is it going to, I think we need to recognize no pandemic is identical to the last pandemic. So there are going to be issues that we cannot anticipate, but definitely we're in a better position to address it, no doubt.
Absolutely. Well, thank you so much for being here. Christine Chandler represents New Mexico's 43rd District. Representative Chandler, thanks so much for joining us today.
Thank you so much for inviting me, and look forward to talking with you again.
And now moving on, our final guest today is Reyes Mata III. He's an independent journalist and has done work for the Southern New Mexico Journalism Collaborative, and he's covered a wide array of issues, including COVID recovery in New Mexico. Reyes, thanks so much for being with us today.
Absolutely. Thanks for the invite.
Of course. So just to start off, why don't you tell our audience what solutions-based journalism is, the type of reporting you've done, for the collaborative and why it's important to hit that angle for stories like COVID-19.
Well, when you've been involved with journalism, either as on the writing side or as a reader or viewer, you always hear the complaint about news being presented in a way that tends to focus on the negative, and so people are left with an understanding of what's going wrong, but oftentimes they still have that interest in, well, what can we do about it? Is there something that can be done about this problem? And so what solutions journalism is, it's presenting a problem that exists in society, but it's presenting it in a way, it's through a solutions lens to show what has been done to successfully address that problem, and it incorporates lots of data. It incorporates people who have been involved with that solution, them talking about what worked for them, what didn't work, how things look in the future for that particular issue. So the goal for a strong solution story is that the reader, after having read this or viewed the topic, they know what the issue was, but they also know what's being done to address that, and more importantly, what is being done to successfully address that. Not just measuring people's opinions, but actually looking at data to see if indeed it was if that issue was improved. And every solution story also leans forward to look at how that solution's concept could be applied to other similar scenarios.
Sure. So basically it's a way for journalists to connect with audiences, sort of so they can walk away having learned something, not just, oh no, this is a problem, and sort of feeling bad about it, but there are solutions and people are working to address them. And maybe even the audience could walk away with something that they could do themselves, right?
Exactly.
Right.
And sometimes people mistake solutions journalism with advocacy journalism. A journalism piece going out, really putting forth a particular perspective or wanting to speak up a particular project. But solutions journalism relies on data, so that people can be very secure after they read the story that, yes, it's a success, not only because the author is writing that it is, but because there's a presentation of very hard data that shows how successful that project has been, or that issue has been.
Absolutely. So let's move on. Let's talk a little bit about your own reporting, on the COVID-19 pandemic within our Borderlands region. One of my first questions is, what is the biggest difference that you saw? Because you've done a lot of reporting in rural communities. So how did you see a difference between rural communities and larger cities in terms of dealing with the COVID pandemic and finding sort of solutions to, stay functional as a society, basically?
Yeah, I noticed a difference right away. In the urban areas, there was very much an adherence to what the science was showing, very much an adherence to following all the different protocols. And in the rural areas, there is very much the belief that life could not stop, that certainly there is a healthy way of living and there's a responsible way of living, but that your quality of life, the way that you're conducting yourself with you and your family and those interactions and you and your business, that still had to remain a high priority. And I remember speaking with a rancher, and he gave me just a very compelling argument, I guess you can say. When I asked him, I said, there would be critics who look at people not masking, who look at who look at people who are hesitant about the vaccine and who aren't really applying all the different health protocols to the pandemic. They can look at that and be critical of it. And he said that he understood, but he said, as a rancher, somebody who has the responsibility of making sure to put food on the plate for American households, to make sure that the animals are taken care of, to make sure that all the different components that are required for supporting households, particularly during a pandemic, that you really needed to have that type of attitude, that type of perspective. people who would continue to move on regardless of whether there was or was not a pandemic, because they saw it as their moral responsibility to make sure that nothing was going to stop them. So he said, an explanation for us downplaying the pandemic is not because we're flouting science or trying to do anything like that, but because we have to continue that process of providing for American households, regardless of what circumstances exist. And when I heard him explain it in such a way, I tended to look at it not necessarily as being irresponsible, but it gave me an understanding on they have a different way of looking at their social responsibility. And once I could see it through his eyes and how he explained it, I could understand more of the anti-masking and vaccine hesitancy, because they saw it as they did not want to be slowed down by anything, including government protocols.
Sure. And I can imagine there were probably people in those communities who were very concerned about being left out of the community because of feeling a different way from everyone else.
Not necessarily, because in those rural communities, especially like on the farms and on the ranches, they already had a pretty tight network, and they were very comfortable in the understanding that they had a different type of lifestyle. So they're already used to leaning on each other and understanding that they are different, that they are unique. So when the pandemic came around, they turned to each other again to reinforce that same perspective that they had. So I guess them feeling different, they've always known that they have a different lifestyle, but it didn't seem to sway them in any way. They would describe Santa Fe and Albuquerque as reacting too hysterically about the pandemic, and they wanted to distinguish themselves as, we're not Santa Fe, we're not Albuquerque, we're out here, and we understand that things are going to happen, and we're not going to let it phase us. So I never got the feeling that they felt ostracized or insecure in their particular beliefs. They seemed to reinforce their philosophy during the pandemic.
Okay. So, and I know you did a lot of reporting in like Chaparral, Columbus, Deming. I kind of want to talk about the healthcare in rural communities and how is the disparity between big cities like Albuquerque and then, smaller areas like that. And throughout the pandemic, did you see any sort of legislative or even homegrown efforts to sort of address the disparities in healthcare between rural and big city communities?
The state government was very proactive in providing health information to communities. And so when I would speak to people and I would ask them to rank how the state government reacted to the pandemic, I almost always got a pretty high ranking, where they said they really did try to let us know where we could go, what we should do, what the risks are. But in terms of smaller communities and having access to the type of health care that would be required when somebody becomes critically ill with COVID, lots of times in southern New Mexico, they would have to drive to El Paso. It was quicker for them. Like, let's say in Columbus, New Mexico, I spoke with a woman there whose mother became ill, and at first they thought that she was having a stroke, and they weren't sure what to make of that. And so they decided, well, what is it that we're going to do? And they decided, well, the quickest thing for us to do is to drive to El Paso. So they drove to El Paso, and they were doing that drive back and forth between Columbus and El Paso, which they had to leave their mom over there. And after their mother was admitted into the hospital, they never saw her again. There was very strong COVID precautions on who could go into the hospital. And so it would have, had they been in a larger community, like Albuquerque in New Mexico, they would have had easier access to be able to visit and to stay, close by to the hospital, or to stay at home and still, not have to worry about driving a couple of hours to go back home and go back to the hospital. So El Paso, Texas kind of played into southern New Mexico's response to hospital needs during the pandemic.
Definitely. So I know mental health has also been something that you've reported on throughout the pandemic. Can you tell me a little bit about that, how the pandemic, in your eyes, affected mental health overall, and some solutions aspects that you may have come across in terms of helping treat those ailments and the problems that have been arising because of isolation and things like that?
Yeah. Well, the state government also with mental health, they were pretty proactive in getting information out there, and they turned to a lot of the community centers to provide leaflets, to provide Meals on Wheels, to when the pandemic started to ease a bit and people could go out and become social again, it was the recreation centers, the community centers that also stepped up to try to do this in a way that still moderated interaction, because they recognized right away that the pandemic, health-wise, was devastating, of course. But then when you put in the idea of isolation, and when people are sick, they've been so accustomed to turn to family members for help and for support. And if you were sick with COVID, or if you were sick during COVID, that family infrastructure was no longer there. And that had a very strong impact on people's mental health. I remember speaking with a woman in Anthony, and she described herself before the pandemic as being very outgoing, always wanting to visit her children and being very social. She got a really bad case of COVID. She was down for a couple of weeks, and she still had some long COVID symptoms when I was speaking with her. But she said there was an actual change in her personality. She could no longer go out. She was very nervous and apprehensive about visiting people, about people coming over. And what she described it was a textbook description of a depression, what she was describing to me. And so I asked her if she felt that she was depressed, and she thought about it, and she said, yeah, I think I am depressed, and I think that COVID not only wreaked havoc on my body, but it changed my personality. It changed who I am now, and I miss who I used to be. And so she was in that state of depression, realizing that there was her before the pandemic, there was her before COVID, and then there was her after COVID. And she was trying to reconcile the two very different personalities.
Right. And, in my own reporting, I've come across people that say they have long COVID and all these terrible symptoms that come with it, including mental changes and things like that. And now that the federal government has, COVID is no longer declared as an emergency, a lot of those people feel like they've been left behind, and that, COVID is still a huge, an emergency for them and something that they have to live with every day. Can you tell me about your reporting on that, and what do you think, I know we're just journalists, but what do you think could be done to help these people?
It's really critical that long COVID remain in the public eye, that people understand that initial phase of the pandemic, of COVID, was just that. It was the initial phase. Now everyone's kind of acclimated themselves to, the new normal, but there's so many people who are still suffering. And if there's no longer a public dialogue going out about long COVID, you know how politics work. They tend to send money where people are asking for the money to be sent. And if there's nobody that's no longer talking about long COVID, the funds run the risk of going elsewhere. But it very much is a continuing pandemic. It's just a different phase. And so it's going to be very critical in the media for us to continue to highlight the medical needs of long COVID. And so it's very important for us to continue going out, talking to people, archiving, and reaching out to governments and to the healthcare industry to see exactly what's being done to make sure that long COVID is as urgent a need now as the original COVID strain was when it first came out.
Right. So do you think enough is being done to address these potential health impacts to the healthcare system that could be, people with long COVID coming forward and maybe even their symptoms getting worse? Do you think that's something that, has been addressed enough?
I don't. But I think the communication, the most important thing that's happened to address what you're talking about is that the communication has been established. Things like being able to call a doctor, communicate with a doctor online, to be able to, when you feel that you have these symptoms of long COVID, to be able to reach out to somebody in a way that's more convenient. And in New Mexico, that was another one of the vulnerabilities that presented itself after the pandemic started, was that a lot of people did not have access to a broadband internet connection or an internet connection at all that was strong enough for them to be able to have, to meet with their doctor, to have Zoom meetings, and so that was that very much came to the forefront of one of the critical needs of New Mexico to address the pandemic, was them investing in the broadband infrastructure of the state.
And let's talk a little bit more about that. I mean, you have been covering this for a while, and this is one of the things that was, like you said, was really jump-started by COVID-19. So how have you seen, people are worried about the kids and their own the kids' education and how they're going to be affected for years on end. How's this broadband internet going to help with that type of thing?
Well, it would definitely help. And the state government, utilizing all the federal dollars that have come in to address the broadband infrastructure, especially with rural communities, the state government is really has it as a high priority to be able to address that. So they're involved in having different focus groups that are traveling around the state, doing that community outreach so that people can understand that there's ways for them to be able to qualify for inexpensive broadband infrastructure, and also the long-term plans on building up the infrastructure, having the wiring, having the internet set up in communities that historically have not had access to that. But where the problem is there's still a disconnect to a large extent. I would go out and I would speak with the broadband officials who were visiting a particular community to see what the plans were, and it was very clear that they did their homework. They understood what they were going to do with the money. They had a very clear plan on how to initiate it. But after that, I would go out into the neighborhoods in that very same community, and I would ask people, have you heard about that you can qualify to pay for inexpensive internet? And the majority of them said no, that they had not heard about that. A lot of it has to do with their language barrier. A lot of it has to do, particularly in southern New Mexico, with people's immigration status. Lots of times there's a concern that they might be tracked, that if they're here illegally, they're very hesitant to deal with any sort of government program. So there is a breakdown there. And so while the state government has been really diligent and really proactive in doing it right and maximizing the federal dollars, there's still a lot of people out there who would qualify, who should qualify, who have not heard about that. And so that needs to be a top priority also, is getting the message out to them. And I think it's very important to say that when people are looking to qualify for broadband programs, that there is absolutely no tracking that's done. There's no coordination. There's no connection at all with immigration, and so people's immigration status does not play into that in any way at all.
Absolutely. So I just have one more question for you. We're running out of time, but what do you feel, and as a journalist who hits a lot of these solution angles, do you feel if another pandemic was around the corner, or whether it's next month or in 10 years, do you think that we've learned enough as a nation to be able to face it better than we did with this last one?
Yeah, that's a great question. Absolutely not. I mean, it does not bode well, how the country responded to this pandemic does not bode well to the future pandemics, because we know they're coming, and there was so much resistance against health protocols. And while there is that very understandable philosophy from the farming industry, from the agricultural industry, to not let anything stand in its way to make sure that food keeps coming for them, and they need to continue to provide that. That's entirely understandable. But it seemed to get to a level just throughout different segments of the nation, almost a way of being braggadocious and flaunting health protocols, and it affected a lot of people's lives. A lot of people died because of that. And I think there is a concern with many of the national experts that the next pandemic that comes, if we react the same way, we're not going to be able to beat that pandemic. And it's probably because this pandemic, people are looking at it as over. People are looking at it as, well, it really wasn't that bad, that the one that's coming up, and this is the sense that I get when I speak with some people, the next pandemic that comes up, they're not going to apply the same urgency as they did before. So as bad as the country reacted to these health protocols, I think it's going to be even worse the next time, because they've been conditioned somehow to think that we already got through it once, we overreacted, we're not going to overreact again. But that's a very concerning attitude to have.
Reyes Mata III is an independent journalist and a reporter for the Southern New Mexico Journalism Collaborative. Reyes, thanks so much for talking with me today.
You're very welcome. I appreciate the time.
Thanks so much for joining us for Issues and Answers, COVID-19 Recovery. Signing off for KRWG TV, I'm Johnny Coker.